Communicable diseases are a big challenge in India. They're like an unseen enemy. These diseases spread quietly, affecting many people's lives. India has fought these diseases for a long time. This fight is very important and continues every single day. The health of the nation depends on it. The scale of this challenge is huge. India has a very large population. Over 1 billion people live here. The country's land is diverse with mountains, plains and coasts. These factors make disease control hard. It requires constant effort. We must always be watchful. These diseases impact people deeply. They also affect the entire country. They cause a heavy health burden. People get sick and cannot work, leading to economic loss. Overall development slows down, so fighting these diseases is a top priority. Public health efforts focus on this. This essay will explore India's fight. We will look at these diseases closely. What are they? How do they spread? We will understand the national programs. These programs aim to control diseases. We will also see the challenges and the path forward for a healthier India. This knowledge is important for everyone. What are communicable diseases? They are illnesses that can spread. They pass from one person to another. Sometimes they spread from animals to people. Tiny living things called germs cause them. These germs are also known as pathogens. Understanding them is the first step. This helps us fight them effectively. Many types of germs can cause these diseases. Bacteria are one common type. Viruses are another major group. Fungi can also cause infections. Parasites are yet another kind. These germs are very small. You cannot see them without a microscope, but they can be very dangerous. How do these diseases spread? There are several ways. Direct contact is one way. Touching an infected person can spread germs. Coughs and sneezes release tiny droplets. These droplets can carry germs through the air. Contaminated food or water is another source. Insects like mosquitoes can also carry diseases. These are called vectors. Knowing how diseases spread is crucial. This knowledge helps in prevention. We can take steps to stop the spread. This is called breaking the chain of transmission. Hand washing is a simple but effective step. Covering coughs helps too. Ensuring clean water and food is vital. Controlling insects also plays a big part. Tuberculosis, or TB, is a major concern. It is an ancient disease but still affects many people in India. TB mostly attacks the lungs. It can spread when an infected person coughs. Tiny droplets with TB bacteria enter the air. Millions of people in India get TB each year. The government works hard to treat it. HIV/AIDS is another serious disease. HIV stands for Human Immunodeficiency Virus. This virus attacks the body's defense system, known as the immune system. When it gets weak, people get sick easily. HIV spreads through certain body fluids. There is no cure yet, but treatment helps. People with HIV can live long, healthy lives with medicine. Malaria is spread by mosquitoes. When an infected mosquito bites someone, they can get malaria. It causes high fever and chills. Malaria is common in many parts of India, especially in areas with a lot of rain. It can be very dangerous if not treated quickly. Preventing mosquito bites is important. Using mosquito nets helps a lot. India faces other communicable diseases too. Dengue and chikungunya are spread by mosquitoes. They cause fever and joint pain. Diarrheal diseases are common. They spread through unclean water or food. Hepatitis is a liver infection caused by viruses. Each of these diseases needs specific attention. India has programs for many of them. For example, in 2022, India reported over 1.5 lakh dengue cases. What is epidemiology? It is the study of diseases in populations. Epidemiologists look at patterns. Who gets sick from a particular disease? Where do they live? When do they get sick? This information helps us understand diseases. It guides public health actions. The burden of communicable diseases in India is high. This means many people get these illnesses. This puts a lot of pressure on hospitals. It also affects the country's economy. When people are sick, they cannot work. Children miss school, families suffer. Reducing this burden is a major goal. Morbidity means sickness. Mortality means death. Communicable diseases cause high morbidity. They also cause many deaths in India. Young children are especially vulnerable. Older adults also face higher risks. Poor communities often suffer more. Access to healthcare can be a challenge for them. Good data is very important. We need accurate information about diseases. This helps in planning how to fight them. Surveillance systems collect this data. They track where diseases are spreading, but sometimes there are gaps in data. Making these systems stronger is essential. Better data leads to better decisions. Section 5. The blueprint for defense evolution of national health programs. India started fighting diseases long ago. After independence in 1947, this was a focus. The government targeted major killer diseases. Smallpox was a big problem then. Malaria was also widespread. Specific programs were created for these. These were called vertical programs. Each program focused on one disease. Over time, these programs changed. India learned from experience. New diseases emerged as challenges. The old ways were not always enough. There was a need for better coordination. Integrating different health services became important. This meant programs started working together more. The aim was to build a stronger overall health system. The approach to diseases also shifted. For some diseases, the goal changed. It moved from just controlling them. The new aim was to eliminate them completely. This means stopping their spread entirely. There was also more focus on primary health care. This means providing basic health services closer to where people live. The National Health Policy of 2017 is key. It provides a roadmap for health. It aims to ensure good health for everyone. This is called universal health coverage. The policy strongly emphasizes communicable diseases. Preventing them is a major goal. Controlling their spread is also critical. This policy guides all current health programs. Section 6. India's arsenal, key national health programs in action. The Integrated Disease Surveillance Program, or IDSP, is vital. It acts like a watchdog for diseases. It collects information from across the country. It looks for early signs of outbreaks. If a disease starts spreading fast, IDSP helps detect it. This allows for a quick response. Health teams can act fast to stop it. It is an early warning system for public health. India has specific programs for major diseases. The National Tuberculosis Elimination Program, or NTEP, fights TB. Its goal is to eliminate TB from India. It provides free testing and treatment. The National AIDS Control Program, or NACP, tackles HIV/AIDS. It focuses on prevention and care. It also works to reduce stigma. These programs have dedicated teams and resources. Other diseases also have dedicated programs. The National Vector-Borne Disease Control Program, or NVBDCP, handles diseases like malaria and dengue. It focuses on controlling mosquitoes and early treatment. The Universal Immunization Program, or UIP, is crucial. It provides free vaccines to children and pregnant women. Mission Indradhanush, or MI, is part of UIP. It aims to reach unvaccinated children. The National Viral Hepatitis Control Program, or NVHCP, addresses hepatitis. The National Rabies Control Program, or NRCP, works to prevent rabies. The National Leprosy Eradication Program, or NLEP, continues its efforts against leprosy. All these national programs share common goals. They aim to reduce sickness from these diseases. They work to prevent deaths. They strive to improve the quality of life for patients. A very important goal is to reach everyone. No one should be left behind, especially people in remote areas and those from poor communities. Section 7, the Command Center, Institutional Framework and Guiding Lights. The Ministry of Health and Family Welfare, or MOHFW, leads India's health efforts. It is the main government body for health. The ministry makes national health policies. It decides how to fight diseases. It also allocates money for health programs. It oversees how these programs are run. Their leadership is crucial for success. They coordinate with many other agencies. The National Center for Disease Control, or NCDC, is an expert body. It is located in Delhi. NCDC plays a key role in disease surveillance. It investigates outbreaks of diseases. It provides technical help to states. It also trains doctors and health workers. Research is another important function of NCDC. They study diseases to find better ways to control them. State governments play a very important part. Health is a subject managed by states in India, so the actual work of running programs happens at the state level and also at the district and local levels. Good cooperation between the central government and state governments is essential. This partnership is vital for programs to succeed. Funds and guidelines come from the center. Implementation is done by the states. Several guiding principles shape these health programs. Equity is one important principle. This means everyone should have fair access to health services. Affordability is another. Care should not be too expensive for people. Quality of care is also stressed. Services should be effective and safe. Community participation is encouraged. Involving people helps programs succeed. Using data to make decisions is also a core idea. Section 8, Victories and Vigilance, Successes and Evolving Challenges. India has achieved some big victories. Smallpox was once a dreaded disease. It killed millions. India successfully eradicated smallpox in 1977. This was a huge achievement for public health. Polio is another disease India has fought hard against, and India is now polio-free. This was declared in 2014. Guinea worm disease has also been eliminated. These successes give hope. There's been progress against other diseases too. Malaria cases have come down in recent years. Deaths from malaria have also reduced. The spread of HIV has been controlled. New HIV infections are much lower than before. Efforts to control tuberculosis are showing results. More TB patients are being diagnosed and treated. These are positive signs of progress. But the fight is not over. New challenges keep emerging. Drug resistance is a serious problem. This means some medicines no longer work. TB bacteria can become resistant to drugs. Malaria parasites can also become resistant. This makes treatment harder and more expensive. New infectious diseases can also appear. COVID-19 was a recent example. Nipah virus is another. Climate change might also bring new health threats. India must always be ready to adapt. We need research for new medicines and vaccines. Surveillance systems must be made even stronger. They need to detect new threats quickly. Social factors also affect health. Poverty, nutrition, and sanitation play a role. Addressing these issues is important. Our health systems need to be strong and resilient. They must handle shocks. Section 9, the long road ahead, sustaining the fight for a healthier India. Communicable diseases are still a threat in India. Much progress has been made, but the journey to control them is long. We cannot afford to become complacent. The health of future generations depends on our actions today. Sustained effort is very important. The fight must continue with full energy. This is a commitment we owe to ourselves. Continued investment in health is essential. This means spending more money on health. We need better hospitals and clinics, especially in rural areas. We need more doctors, nurses, and health workers. They need good training and support. Research into diseases and treatments must continue. Strong political will is also vital for this. The community has a big role to play. People need to be aware of diseases. They need to know how to protect themselves. Adopting healthy behaviors is key. Things like hand washing and using mosquito nets. Seeking medical care early if sick is important. A strong partnership between the health system and the people is needed. Everyone has a part in building a healthy nation. Our vision is for a healthier India. An India where fewer people suffer, where preventable diseases are actually prevented, where children can grow up healthy and strong. This is a goal worth striving for. It will take hard work from everyone, government, health workers, and citizens. Together we can make this vision a reality. The path is long, but the destination is vital.